This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
Welcome to the human side of healthcare. Steve Love here along with Thomas Miller. And you know, our title is The Human Side of Healthcare. And we are absolutely delighted that we've got a wonderful guest. By the way, it's Janet St. James, and I think most of our listeners know Janet. She is the Assistant Vice President of Strategic Communications for Medical City Healthcare here in North Texas. She worked for 18 years at WFAA. And trust me, she interviewed me, and she always asked much better questions than I gave answers. But it is a delight to have her here today. And
now you get to turn the tables.
I get to turn the tables.
This is definitely uncomfortable for me because I prefer to be the one asking the questions, not answering the questions.
Many of you may or may not know, but Janet has been very open about this. She's been diagnosed with breast cancer, and when she moved from WFAA to Medical City Healthcare, she was actually diagnosed the week before she started. That's got to be something, Janet, that really made you pause.
I don't think pause is an adequate enough description of the crisis that I was in. Honestly, I was really officially diagnosed the Friday before I showed up at Medical City Healthcare.
Wow.
Yeah, my appointment with my doctor was at 5 p.m. on Friday, so I really didn't know what I was dealing with until the midnight hour. And I called my boss on Monday morning as I'm supposed to be showing up for orientation at 7 a.m. and said, "You're not going to believe this. What do I do?" And she said, "Go to orientation and we'll figure it out." So I went to orientation about as scared as I'd ever been about anything. Because how do you walk into a job with a cancer diagnosis? And a cancer diagnosis, I knew by that time that my cancer had already spread. We could see it on the scans that it had spread to my lymph system. So I had no idea what was going to happen.
You know, as you mentioned, metastatic breast cancer, and you're going to talk about this. Many of our listeners probably have family members, loved ones, friends dealing with this. And I know you've told me you don't want to be called a survivor and you don't want to be called inspirational. Can you talk to our listeners and explain to them what you mean by that?
Sure. First of all, let's dispel some discrepancies between a cancer diagnosis, a breast cancer diagnosis, and a metastatic breast cancer diagnosis. So breast cancer is usually the initial diagnosis before the breast cancer has spread beyond the breast. Metastatic breast cancer is when it's spread to the tissues, usually the brain, liver, lungs, bones. Those are the primary sites of spread. And about a year ago, I was diagnosed with metastatic breast cancer. That is an incurable breast cancer. There is treatment, but treatment may or may not work, and it's pretty much impossible to tell who it's going to work for and who it's not going to work for. So that's what metastatic breast cancer is. That's what Shannon Doherty announced that she also has. Her breast cancer has spread to beyond the breast, and I don't know where her cancer is spread. Mine has mostly spread to my bones and significant spread to my bones. So even before I was diagnosed with metastatic breast cancer, I didn't like being called a survivor because I hadn't made it to that 5-year mark where you're considered quote unquote cured. And now I will not be a survivor. Unless there is a cure, I will not be a survivor from breast cancer. It's considered a terminal disease, and that is what it is. I wish I could change it, but right now there's not changing any of that. And I don't really consider myself inspirational. I'm just a doer, and so I'll do until I do no more.
You know, Janet, you look great today, and I know there's a stigma and a misconception that when you have cancer or some kind of terminal type cancer, you need to look and act sick. Do you have any comments on that?
Some days I feel like I'm looking and I'm acting sick, but I don't look that way all the time. And I think to the outside public, those who don't know me, they would not know that I was as sick in my cells and in my bones, especially as as the scans and the tests show that I am. I think sometimes you do look sick, but I don't think you always have to. And with metastatic breast cancer, there are emerging treatments, and you can live for years. I am very heartened by stories of women who make it a decade. I mean, that's big for me. That gives me hope. And I see pictures of other women that don't look sick. I look at Shannon Doherty, and I also think she looks great. And she's been living with this in silence for a year, and nobody knew. So it shows that those preconceptions are not always factually accurate.
Right. Thomas, I know you've known Janet for a number of years, and obviously you've been...
I know both of you guys for a long time.
I think that means we're old,
Or I'm old, too. Hey, I'm happy to be old.
And Thomas,
we're not old.
We're experienced. We have a lot of
We're
experience at this
veterans.
table. Right.
Yes.
but you've known Janet, and you know so many people in the broadcast industry. And Thomas does a great job co-producing this show. So why don't you jump in here, Thomas, because I know you've got some questions for Janet as well.
Well, the profile. We're connected on Facebook, obviously, and I've watched the way that you've lived this out loud, basically. And what kind of encouragement have you found that to be, not only for yourself but for others? Because I've seen the comments and I know the impact that you're having, and that has to feel great.
It's interesting because social media can be horrible in some ways. It can be a source of bullying.
A bully source, yeah.
But it can also do some great things. And I'm there, as you say, living my ordeal out loud, not in the hopes of getting those sort of positive comments. That's not why I do it. I do it in the hopes that I might be able to help one person out there understand something. But for me, certainly, it's been a source of support. And so I really appreciate those positive people out there. It's nice to surround yourself with positivity amongst negativity.
Now, I know when you get, you have hundreds of people following you and thousands of people following you on this, and you get a lot of suggestions with that. Oh, you should look at this. Oh,
Yes.
you should look at that. Oh, you should talk to this person or that person.
Yes.
How have you filtered all of that for yourself to appreciate those suggestions? And and also at the same time, I mean, like with what you're facing, maybe inside one of those suggestions would be the thing, right? How do you filter that?
Well, there's not the thing out there. Hopefully there will be, but it's not there yet. But I know that people that offer suggestions are offering them to me with the very best of intentions. So I take it for that. I listen to everything, and then I use what I think would be useful for me. And because people offer those suggestions, but they don't know the genetic makeup of my cancer, I'm restricted from taking vitamins and eating certain foods. They can't know that. So I take all of those suggestions in the manner in which they were intended. And I also do my own research. So I've definitely asked my oncologist questions about popular and maybe clicky treatments out there to see what she has to say about them.
That was Janet St. James in our offices back before COVID. Now, fast forward, you can imagine that Janet and her family have had to make quite a few adjustments to keep her safe, particularly during COVID-19, while the family continues to do all that they do. And she'll talk about that next on the human side of healthcare.
This is the human side of healthcare on 1080 KRLD and the radio.com app, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
And welcome to the human side of healthcare. We're delighted to have you with us. And in this segment, we're going to do kind of a follow-up from the segment you just heard, which was a rebroadcast where we had a great discussion with Janet St. James. And Janet, we're going to follow up, and we're in the COVID-19 situation, as you know, and, through your own discussions and your Facebook page, you've shared with people what you're going through and that you're a high-risk individual. So let me just start the questioning by, what are some of the things you're doing personally to really protect yourself against COVID-19?
Well, thank you for having me back again, Steve. I'm super happy to be here to be able to talk about it. I wish that I wasn't one of those high-risk people, but I am. And when this started, as a family, we decided that we would take some extra precautions at our house. I have 3 children. 2 of them returned from college, and they had jobs outside of the house. So we wanted to make sure that we were very careful with everything that we were doing. And I really listened carefully to our health leadership, not just here locally at Medical City Healthcare and across North Texas, but to our federal leaders. As they were learning more, we learned more about what we could do to protect ourselves here at home. So here are some of the things that we did, because I knew I couldn't keep everybody in the house of the bubble. I was here in the house of the bubble working from home full time, but everybody else was leaving the house to do things like grocery shop or go to work. My daughter was a lifeguard at a public pool. So when they returned, we had processes that we did. So we had disinfectant spray at the back door. Anyone who walked in had to spray the door handles, the garage door opener, the refrigerator outside if they had touched it, the door handles of their car, which is something that I think other people don't really think about necessarily. You know, if you're out in public and then you touch something in public and then you open your car door and get in, then you have potentially contaminated your own door handle and your own door, the inside of your car. So they sprayed that, came in, left their shoes outside the back door. And if you were in a public place where you could come in contact with other people and other items, then you had to go upstairs and take a shower. That was our regular process every day if you left the house and came back in. And I'm happy to say that as far as I know, none of us have been infected with COVID-19. So I hope that those processes worked for us.
You know, that's quite a list that you went through. And, you know, I was just thinking as you went and discussed that, Janet, you had 2 of your children return from college, which, you know, they were in situations where they, you know, had seen quite a few people, had been exposed potentially to people that might be asymptomatic. And then your daughter was a lifeguard. So those precautions are just remarkable that you took. Have you changed in the last couple of months some of the things that maybe you did initially?
Not really. And I'll just say for my college students and for us, it was the longest spring break ever. They're back at college, thankfully, hopefully following these same practices. But what we instituted as the best practice in our house remains today, because the only way that we can eliminate or slow the spread is if we all follow the rules all the time. So these were the rules at my house then, and they're still the rules today. No one is allowed into our house without wearing a mask. So if we have somebody that has to come work on something, the air conditioner or whatever, they must be masked. And we practice social distancing inside of our house. All of those things started in March, and they remain today here in the end of August or September.
You know, that is remarkable, especially when you have very compliant family members, as you well know, because most of our listeners know you're affiliated and do a great job working at Medical City Healthcare. But many of the physicians tell me that family spread is a real issue in some parts of the city where one family member infects the entire family. So along that line, your teenagers especially have been very compliant. That is just remarkable.
I don't know about compliance, Steve. It did take a little bit of leadership in making sure that everyone was going to follow the rules all the time. So if I heard somebody coming in, I mean, they knew that I was going to be down there to make sure that everybody was doing what they needed to do. But also they understand that if I get sick, I have a much higher probability of not doing well with the virus because I'm so high risk from stage 4 breast cancer and the medications that I take to help keep my condition stable, but which also reduce my immune system. So they knew that they had to do it, and they had to do it every time. I'll tell you, I have watched others, neighbors and others, and certainly news stories of family spread. And we've just been committed that we're not going to say, okay, we'll just make the rules lax just this one time, just for this one family gathering or for this one instance. We know that we have to follow these rules all the time. Otherwise, this is going to last a lot longer, and I'm never going to get out of the house.
So let me pivot just a little bit, Janet. We've talked a lot about at home, and you just said, get out of the house. Have you been out to the grocery store or to the drugstore or anything like that?
Very rarely. I've been out a few times just to try to maintain my sanity. When my kids were going back to college, I did go to the stores to get a couple of items. But I make sure when I go out, I go at the hours that are meant for those with compromised immune systems, when there are fewer people there, if at all possible. I wear a mask. If there's somebody in the aisle that I'm in, I make sure that I social distance, or I find another aisle to go shop in. While they're there, I really do try to follow the 3 W's, which is wear a mask, wash your hands, and watch my distance. It's interesting when you're really paying attention to it, how many times you touch your face. And I have to be conscious, just like everybody else does when I'm out in public on those rare occasions, not to touch something and then touch my face, because that's how you can cross-contaminate as well. So I try to pay attention to all those things. I have been out, not as much as I would like. I'm really living in my house and in my yard, although I do take walks. I walk to a public park, usually before anybody else is out, and even at a public park, I social distance.
You know, that's great advice. And the 3 W's, as you mentioned, are certainly something each and every one of us should follow. If you are in the aisle at the grocery store, even though you go at the appropriate time for people that have compromised situations, have you seen anyone that wasn't wearing a mask? And if you did, what did you do?
That's a good question, because Steve, I'm not afraid to call someone out if they're not following the rules. Initially, I remember going to a grocery store probably back in March or April, just a rare occasion, and there was a couple shopping, and I looked at them and I said, hey guys, you have to wear that mask over your nose in order to protect people like me. And they looked at me with a little bit of shock at first, and then they thought, okay, yes, I'm here. I have a mask. I should wear it right, because she's right. They immediately put the mask over their face and put it on correctly and moved on. I'm happy to say that on the rare occasions that I've been out lately, I went to 2 stores in the last 2 weeks. Everyone was wearing a mask. There are occasions where I see people still not wearing a mask correctly, and I can tell a clerk in the store, say, hey, listen, can you get them to put it on correctly? And for the most part, they'll do so. If you ask nicely, people will comply with it.
You mentioned a couple of your children, I think you said 2, have returned to college. So are they back in college now?
They are back at college. Most of their classes are online, but they do have some labs and other smaller classes that will be in person. At least we hope that they'll be in person. They know the rules, and I hope that they're being responsible and not going to parties or having gatherings, and really trying to be responsible, because that's the only way they're going to be able to stay in school in person.
So if they come home for a weekend or come home to visit you, are you going to put any special rules in place now that they've been at college?
After the world's longest spring break, I doubt that they'll want to come back for a weekend anytime soon. But they will be back probably at Thanksgiving would be the next time, unless classes are canceled. And at that time, we'll social distance and mask. And before they come home, I will ask them to do their best to self-quarantine. At the University of Oklahoma, where I have a son attending college, they had to take a COVID-19 test before they were allowed back on campus. So I know he is negative. And perhaps with improved testing, that may be, if we haven't slowed the spread significantly, I may ask them to take a test before they come home as well.
You're listening to Janet St. James, who, for those of you who have been in the Metroplex for a while, remember that for nearly 20 years gave us healthcare and medical news over at Channel 8 News. And now she is the Assistant Vice President of Strategic Communications at Medical City Healthcare here in the Metroplex. And just as she made that transition, she was diagnosed with breast cancer. And that has been her very public journey as she's been helping inspire so many people who are on this same path. When we come back, more with Janet and how her family has been coping with COVID and breast cancer on the human side of healthcare.
The DFW Hospital Council, along with our over 90 member hospitals in North Texas, are proud to bring you the human side of healthcare with Council President and CEO Stephen Love and co-host Thomas Miller.
And welcome back to the human side of healthcare. You know, Thomas, what a remarkable lady, Janet St. James. You know, when she was a reporter at WFAA, and I wasn't kidding, boy, she could ask some tough questions. And she used to really ask me and make me defend my position, whether it be Medicaid expansion or whatever. What a remarkable lady. Isn't it just fun to talk to her?
It sure is. And it reminds me of that era of journalism that has left us, I'm afraid, of people who were not afraid to ask the tough questions and look you right in the eye with all due respect and call you out if you're not being consistent. Boy, do we need that today. And that has disappeared from journalism. It is great to have her on the human side of healthcare.
Absolutely. And, you know, she is very direct, but she's also very fair. She has what I call total professional ethics.
We've been talking to Janet about what has been going on in her life and in her home since COVID. Janet, what are you doing specifically to get your own personal support?
I belong to an online support group for other women dealing with end-stage breast cancer. And we talk often, and it's not just breast cancer, it's anyone dealing with a high-risk medical condition like this. We talk often about how isolated we feel because we don't feel like we can go out in public, and how frustrating it is for us to be literally holed up at home, and some of us in small homes or apartments in circumstances that the quality of life is not as good as it could be. So we really, really want people to follow the rules because we'd like to get out there and live again. I missed a bucket list trip that I can't replan. I don't feel like it's a good idea for me to get on a plane right now and travel places. And I'd really like to live again while I still have an opportunity to do that. But we really need everybody to follow all the rules all the time.
Janet, I had one thought as you were just mentioning the support group. If we talk to other high-risk people, so folks fighting cancer or heart disease or any other thing that might put them in that same category of if you get this, it might be a pretty rough road. What are some of the things that are coming up from that support group that you're talking about, things that you've agreed about or you're helping each other with?
I think we all help each other with that virtual emotional support because we cannot be around other people. And in some cases, like I've only seen my own parents a couple of times. They're in their 80s. So they're at high risk. I'm at high risk. And so the ability to have a phone conversation or FaceTime has been really important for us so that we have that emotional support because we don't get out there to see people in person. I don't even have social distance gatherings, with my neighbors on the back patio. At the end of the evening. I'm just not ready for that yet. And so it can feel very isolating. I think those connections, those human connections are really, really important right now, especially if you know someone who's at high risk and can't get out.
And I know anybody listening to this who has cancer or a family member with cancer has talked to their oncology team about this, but what are they telling you about your immune system and about the medications and about COVID?
Those of us that are on these immune repressing medications know that that we're at risk. And so we're just following the rules the best we can. I don't know that we're hearing anything extra special, except that we just need to take extra care to make sure that we're protected and that those around us that we come in contact with on those occasions are also doing their part to be protected. It is interesting, though, that many people get an opportunity to experience what it's like to deal with these issues all the time, because once COVID-19 passes, and I hope it will pass, some of the things that I think about all the time in terms of protecting myself, those will continue on, even afterwards. But those that have never had to deal with it, coming to terms with your own mortality, coming to terms with the mortality of your loved ones, making decisions based first around your health instead of what would be fun or enjoyable. Those are all things that I will think about long after COVID-19, I hope. Those are things that people today that don't have those high-risk health conditions are thinking about because of COVID.
I know when we saw you in person last, before COVID was part of our vocabulary, we did an elbow bump. We didn't do a touch type greeting, and you were doing that anyway. Now that was during flu season. So are these things that you would have done during flu season this time of year anyway?
My colleagues will tell you that I haven't shook someone's hand for many years just because I think it's a way to spread viruses. So I hope that handshakes may go away and we can continue with air high fives and elbow bumps because they're just as good and they don't spread as many germs. So yes, I was doing those long ago and I will continue to do those.
The Japanese bow, right? We should bring that in. The formal bow as a greeting. There you go.
I saw somebody do knee bumps, but those seemed a little bit more awkward to me than the elbow bump.
We could kick each other's toes.
Right.
Now, what are some things that because this is really great for helping people determine that line. So if somebody is healthy, but now we've had all this programming, if you will, of avoiding this virus. What are some things that you would have done normally if COVID was not around as flu season approached? What are some precautions that you were taking anyway?
I feel like I take most of these precautions anyway. I am pretty careful about hand hygiene. I try to be conscious about not touching my hands to my face. So I feel like I was doing them. I am really heartened by watching other people do them now. So I hope that those habits last into flu season because otherwise we may have the double whammy. I hope we don't. And if everybody follows the rules, not just for COVID, but also for flu, I think that we can mitigate the risk of having a very serious flu combined with COVID season.
As you think about this, the last several years of your life, and then comes COVID, and then comes all this other stuff. Is it almost like we're going to wake up one day and the dream will really be over?
Not for me. I wish that was the case. For me, this is reality for me. Maybe when I was first diagnosed with breast cancer, I wondered if my life would ever return to normal. Now I know it's never going to return to normal. So for me, this is my reality from here on out.
Do you think you'll ever fly again?
I sure hope so. I had a trip planned to Italy in April that I had to cancel. So I'd really like to go see Italy. I'm watching some documentaries on TV and it's not quite enough. I'd like to go see it all in person.
What's the number one thing you do to keep your spirits up day to day?
I exercise. I am an avid walker, and I have a little dog who is a walker with me. So I like to take walks in the morning. And if I can take an hour walk in the morning, it definitely helps keep me positioned for a better frame of mind during the day. I loved going to the gym prior to this, and I miss going to the gym. So I'd like to be able to get back to the gym so that I could do some group fitness because I am highly motivated by having people around me that peer pressure me into staying for the entire hour instead of me doing it, in my living room where I feel like I can step away for a minute to make a cup of coffee or something else like that. So I try to exercise and I look forward to getting back to group fitness once this is ended and I can get back to the gym.
How is work going for you?
I'm lucky to have a job that I can do from my home, that I can do from my computer, and I have a nice setup here, and from my cell phone, I can do everything that I need to do from home. But you can get stir crazy. There's something to be said for going into the office every once in a while and interacting with other people, even if it is for meetings that you would otherwise be aggravated by. There's something to be said for that human interaction. So it's going well, but I'd like to see people again.
A lot of people out there have followed your story. Do you have one piece or a piece of parting advice that you would give to those who are fighting cancer as well as COVID?
I would say keep your spirits up in whatever way works for you. If it's exercise, great. If it's watching a relaxing cooking show that inspires you to do something that will bring joy to your life, that's fantastic. If it's reaching out to friends or family or coworkers and having a virtual happy hour so that you can feel like you're with someone without being with someone. I think that it's important for us all to find reasons to keep joy in our lives.
Janet, thank you so much for being with us. And you know, Thomas, what a way to end that discussion. Keep joy in your lives. Great advice.
It is. And during this time, I know people have been struggling with that, Steve, and it's been something that everybody's having to find their own internal switch to be able to turn that on.
And you know, I look at the healthcare workers and the people that are first responders. They deserve so much credit because they're keeping their heads high and joy in their lives as they go out literally and risk their lives every day.
And so many of those healthcare workers are women. And I know you've seen things change in this field over the years, and we're going to talk about that next as we explore the topic of women in healthcare.
You're right, Thomas. I'm an old guy. I've been around 45 years, and I have seen how healthcare has changed so much in a very positive way as women have taken on vital roles, not only on the clinical side, but also on the administrative side. And we're blessed to have such strong female leaders in North Texas.
And we're going to be talking to somebody from the Baylor University Medical Center when we come back. Dr. Amy Wilson, who is Vice President of Medical Affairs there and has risen up the ranks from physician to now corporate leader, is going to talk about her path. And before we break away, let's remind you of our podcast. It's called The Human Side of Healthcare, and it's on all the major podcast players. If you just search us up, we are there. And we'd love to have you join us for the full-length episodes that we don't have time for here. Stay with us. The Human Side of Healthcare is back after this quick break on 1080 KRLD
and radio.com.
We're continuing our conversation on how you can empower yourself to have the best health possible in today's ever-changing healthcare environment. This is the human side of healthcare with DFW Hospital Council President and CEO Stephen Love and co-host Thomas Miller.
And welcome to the Human Side of Healthcare. We're delighted that you're with us today. As you know, on the human side of healthcare, we talk about various topics. Today is so important. Women in healthcare leadership roles. We're delighted that Dr. Amy Wilson, who is the Vice President of Medical Affairs at Baylor University Medical Center, is our guest today. Dr. Wilson, thanks so much for being with us.
Thanks so much for asking me to be here.
Well, I'm going to get right to it and ask you a question. It's a well-known fact that we see women rising in healthcare leadership roles. And Dr. Wilson, you may not know this, I've been in healthcare for 45 years, and I can certainly attest that women are definitely rising in leadership roles. Can you explain to our listeners why we're seeing this trend and why it's so important to have female physician leaders?
Sure, I'm happy to tackle that. When you consider healthcare as a whole, you know, approximately 80% of healthcare providers are female. So that includes nursing, physicians, and all the other ancillary staff. So it's healthcare at its core is a very female-led process. For physicians, for female physicians, generally at least 50% of medical school classes are now female. And it's been that way since I started medical school in the late 80s. So given those facts that healthcare is largely female-led, it's a little bit odd that historically leadership roles are dominated by men. So we have seen a change in tide recently, and I would say, you know, maybe in the past 15 years or so, I've seen a great change in that, and more and more females are being given opportunities to lead healthcare organizations, including mine, Baylor Scott and White.
Well, you know, at Baylor Scott and White, and we're blessed here in the Metroplex that we have such good healthcare systems, but specifically at Baylor Scott and White, Is there any evidence of progress?
Yes, definitely. I've seen a much progress in the past few years. I've been in leadership roles for the past 15 years, and I would say early in that time, it was still very male dominated. But I think Baylor Scott and White saw early on the need to even out the scorecard, if you will. We became very interested as a system in providing advanced leadership opportunities for all of our physicians, but especially females. And this has afforded us, the chance to help rise amongst the ranks, so to say. So I think we've made significant progress in that. I've been able to watch the change myself. And I can give you an examples from, the early 2000s where we rarely had any female physicians in leadership roles to now we regularly, we have chief medical officers in these roles. We have lead physicians running their practices that are females. Definitely the playing field is starting to level out.
As a physician leader, you see female leadership. But aside from physician leaders, what, in your opinion, is the state of female leadership in healthcare generally?
So I would say, generally, if you look at the healthcare workforce being made up primarily of women, 80% of women, we've made significant progress. I'd like to highlight our nursing colleagues who probably do a much better job at having female leadership, in the chief nursing officer roles and the vice president roles. Now, the physician side has been slower to change for a variety of reasons, but we are finally getting the progress that we have sought for so long.
Dr. Wilson, you were trained as a medical professional and a physician. Why did you decide to move more into management?
So when I was training and I was much younger, I really didn't view this in my scope of possibilities. I honestly thought I was going to be a part-time doctor and spend more time at home with my children. That's just not how things worked out. And what I found was an affinity to go towards leadership. I think a lot of leadership happens for women because they're capable and available and willing. Plus, my organization afforded a lot of additional executive training that showed that they cared about me as a person and was interested in my development. And it just worked for me. And I was able to run through the ranks. I've been at Baylor Scott and White my whole career, and I was able to rise up through the ranks to a position such as this today. It's not something I envisioned for myself, but I'm so glad to be here and happy to represent female physicians at a very crucial time in history. We're faced now, I'm sure you've had multiple discussions about physician burnout or moral injury. We're faced with these unprecedented times where, we have a pandemic and these burnout issues are even more visible. It's even more important for me to act as an example to others out there to continue to give hope that females will be afforded the same opportunities in the healthcare industry.
If you were speaking to a school group of kids, or even if you had a 13, 14-year-old daughter who said, I kind of might been looking at what you do, might be interested in that for a career, what would you tell a young lady today thinking about medicine?
I'm always excited and blessed that I have had the opportunity to go into a medical career. So there's really nothing greater and nothing more sacred than being able to treat patients and minister in that way. There is so much good in medicine, and I would definitely encourage them. And I'm a good example of how many opportunities there are in medicine. I've been able to have multiple different careers in one. I've treated patients, and I've been able to be on boards, and I'm now in an executive position. These are all things that I really, I didn't understand when I was a much younger person. So there's just so much opportunity and so much excitement left to have. So
where do you see medicine, say, 10 years from now?
In terms of our leadership, I think that we've talked a lot about being on the cusp of a lot of different changes. One thing that we are very focused on, and we have been since the tragic murder of George Floyd, is our diversity. And females in medicine are just one form of diversity. But where we really need to go is expanding that diversity into race, ethnicity, sexual orientation, and other areas. And I think we are, we're finally on that pathway. So I hope that in my lifetime, I get to help really put those diversity changes into play. And we're working on it right now.
What changes do you see that might be permanent in the healthcare system as a result of COVID-19?
The thing that we talk about all the time, and we're doing it right now, is our ability to do things virtually. So whether we're online on a WebEx call, or we're connecting to a patient on FaceTime or another electronic way, I think that is going to be the long-lasting change.
Thank you, Dr. Wilson. Excellent points. Thomas, get that flu shot if you haven't. Remember, this is flu season.
This is going to be the week, actually. I'm going to go get it this week. I wanted to wait until after Labor Day, and then, it takes a couple of days to get effective, or, to a week, 10 days, and then, boy, I'll be ready.
And join us next week as we talk about I'm Listening, as we do everything we can to remove the stigma associated with mental health and prevent suicide.
And we'll be back here on the Human Side of Healthcare on 1080 KRLD.
And radio.com.